So to palpate the medial epicondyle, similar to how we did the lateral epicondyle, we're going to start a couple inches above the elbow joint line, right? And we're just going to start walking down this mid-humeral region, right, past the medial supracondylar ridge, right? And we're going to look for the biggest bony prominence we can find, right? And that happens to be right around here. Now, if I go a little bit further, I'm going to fall off of that, right? If I go back a little bit, that's my big bony prominence right there, and that's my medial epicondyle. Medial epicondyle is the attachment point and the origin point for a number of muscles, most of the muscles of the wrist flexor compartment, as well as the pronator teres, attach off of this medial epicondyle. This is where if we get medial epicondylitis or epicondylalgia, we're going to get some pain just off of this medial epicondyle. Now, another very important structure that we can find on the medial elbow, well, there's actually two very important structures we can find at the medial elbow. If we walk just posterior, I'm going to turn her arm a little bit here, just posterior and a little bit distal, what we're going to find in this area here is our ulnar collateral ligament. Now, in order to assess that, we really want to have the patient's elbow in about 70 degrees, and the reason being is as we extend the elbow, right, what you'll feel is all those wrist flexors, that flexor mass is here. And as we bend it to about 90 degrees, what you'll feel is that'll slide up, and then that ligament is sitting right underneath, right over here. And you just want to be able to palpate that, because if someone had a sprain of that ligament, it would be tender and reproduce their pain. Okay? Another really important structure on the medial elbow is if we come back up to this medial epicondyle, and then we start working our fingers directly posterior, what we're going to find is a groove, right? And in this groove, it's the ulnar groove on the humerus, what you're going to find is the ulnar nerve, right? The ulnar nerve comes down around this groove of the humerus and into what's called the cubital tunnel, which is directly posterior to that medial epicondyle. This is where we can palpate the ulnar nerve. Right? You can actually feel a little bandy structure in there, and the person you're palpating may get a little tingling in their fingers. Right? And if you even want to try and tap it a little bit, you may find that they get a little tingling down in their fingers. This is a test we would use called a Tinel's test that would look for someone that maybe had an injury or entrapment to the ulnar nerve at the elbow.